Welcome back to Yahoo Finance. Well, Pfizer is poised to ask the FDA for emergency use authorization for its COVID vaccine for infants as young as 6 months. And here to help us discuss that is Dr. Marie Elizabeth Ramas, family medicine physician. Doctor, thanks so much for being here. I'm wondering how much of a game changer is this, because it is the last group, right, left to be vaccinated. And many parents with young children who have been dealing with daycare issues and preschool issues are waiting for this shot to be approved. It could come as soon as the end of the month.
We are so excited about this news that has come up. Certainly, you are correct. We have been waiting for this particular age group because we have limited resources as far as how to treat those severe cases. Unfortunately, we have seen in New Hampshire that Omicron does have an increased risk of that MISC-C complication from the COVID virus infection. And particularly for the younger age population that are not vaccinated, there was rising concern amongst the medical community for their safety. And so very excited for this news to come.
And Dr. Ramas, in a similar vein, Moderna just gained full vaccine approval as well. It's the second most widely administered shot in the US. So I'm wondering psychologically, how important is that to give people, let's say, who are on the fence about getting vaccinated, a sense of security that it is actually safe and it is worth getting the shot?
Well, the numbers don't lie. And interestingly enough, despite all of the positive effects that we've seen through the cases of administration of the vaccine over the last 2 years, we still are having hesitancy and resistance. And that's partly due because of concern of the unknown, particularly for our pediatric population. And so efforts to make sure that trusted medical and health providers are providing information that is trusted and evidence-based is of utmost importance right now.
And Doctor, I know that hospitalizations do lag case numbers. So I'm wondering, on the ground where you are, what are you seeing as far as hospitalizations, and how are healthcare staff positioned to deal with it?
We are still taxed here in New Hampshire. Unfortunately, most of our hospitals are still at capacity. I am pleased to say, however, that for our children at ages 5 and below, the rate of hospitalization has been less. However, with the actual adverse effects from this population group, we are still seeing a couple of cases here and there. Luckily so. As far as approach from a public health standpoint, we are bracing ourselves for the next couple of weeks beyond this surge. And so public health officials throughout the state of New Hampshire are recommending to continue with mask mandates as recommended, to make sure that we are holding off and staving off the remnant tail infections and hospitalizations. Certainly our healthcare professionals would definitely be encouraged with that.
Doctor, I want to stay on that mask mandate for a second, because the whole issue has become so politicized, and Republicans led by Minority Whip Steve Scalise just sent a letter to the CDC about young kids being required to mask up. How viable is it for a 2-year-old to be asked to wear a mask? I mean, realistically, they'll put it on, they'll take it off, they'll drool, they'll throw it on the floor, they'll put it on again. So how much value does that provide? And then, on the flip side, we see people in leadership positions like the mayor and the governor of New York at a football game not wearing a mask for a photo op. How much conflicting signals does that send? And there's a sense of, at some point, you have to sort of be realistic about what should be done and what can be done with masking. Where do you stand on all of that?
A lot of great questions there. As it relates to our younger patients and our pediatric patients, I think that we have to recognize that kids are going to follow suit with what their caregivers are recommending for them and what they are trained to do. So being able to put on masks for kids as young as 2 or 3 years old, for the majority of kids, that could be okay. Certainly developmentally speaking, not all children develop at the same rate. And so that level of sensitivity to mask wearing is going to be different depending on the child. But But I think the bigger question is what kind of practices, healthy practices, are we going to enforce as adult caregivers for our children? Certainly wearing masks is not, as some politicians say, abusive to children. It is not restrictive to them. Are children able to still enjoy their ability to socialize and to grow social emotionally? The vast majority, yes. Will there be some cases where we have to make exceptions? Certainly so. But as with all things with public health, we need to do what we can in order to improve the health of our neighbors in our community. That's mask wearing and vaccination. The other question you asked us.
Yep. Yes, go ahead. Go ahead.
Yep. The other question you were asking was about the mixed messages from our public officials to the common community, and certainly we have to do a better job here in the United States. I think that's the best way to sum it up. We need to do a better job of not providing confusing information to the public who are undergoing science in motion right now. So making sure that we're wearing our masks and we're doing our due diligence as leaders, I think, is of importance at this time.
I feel like we're all living experiments. One quick question before we let you go. So some schools are having a test to stay policy are rethinking that policy because they're having such an issue coming up with the test. How important is that philosophy to help keep kids safe? As you say, there are so many more hospitalizations with children being impacted.
That's a great question. Right now, our laboratories, outpatient laboratories, are saturated here in New Hampshire. And so getting a test result from a PCR of someone who either has mild symptoms or has no symptoms and had exposure, that can sometimes take 5 to 10 days to respond and to get actual results. And so the goal here from a family physician standpoint would be to have as minimum risk to our community as possible, while still having the advantage of socializing, particularly for our younger students here, socializing and getting exposure and continuity of care in school. The way that we do that is by doing what we've seen has worked over the last couple of years. I don't think testing everybody and requiring tests is going to negate the need and necessity to continue to wear masks and to get vaccinated if appropriate and available for each person.
Okay, doctor, we'll have to leave it there. Thank you for everything that you are doing to help keep us safe. Dr. Marie Elizabeth Ramas, family medicine physician.